Hello and welcome back for another episode. This is episode number 2, which is part of my introductory series to the very basics of obstetrics and gynecology. The first few episodes of this podcast are really just going to be the building block, foundational information that you need to know if you are going to be rotating on the OBGYN services or ultimately practicing it down the line. Before I jump in, I just wanted to let you know that I have multiple free downloadable resources available on my website at drcaseymiller.com/free-downloads. One of my most recent resources is the smart phrase template I refer to when counseling perimenopausal patients with vasomotor symptoms on what their management options are. Not only is it a helpful reminder of what treatment options there are and the associated risks and benefits, but it makes my documentation quicker. If you're interested in getting your hands on that, you'll be able to access the link in the episode show notes. And once again, for any additional resources, you can visit drcaseymiller.com/free-downloads. Today, I'm going to break down how every maternity ward works, whether you're at the smallest or largest institution. If a hospital has maternity services, you can expect to see these core units when you walk onto the floor. So the maternity unit is made up of labor and delivery, postpartum, antepartum, and triage, and then there's the OR area. So let's start with labor and delivery. This is commonly referred to as L&D. So I distinctly remember being a brand new MS3 on the OB service, and my attending was running out the door telling me to meet her on L&D, and I just immediately had a surge of panic because I had no idea what she meant or where to go. So I said, wait, what is L&D? And she just stopped in the doorway with this empathetic and pitying look in her eyes and said, "Oh, that's so cute. L&D is labor and delivery." And I was mortified. But I hope that reminds you that everyone learns what L&D is for the very first time, and if this is the first time you're hearing it, now you know labor and delivery is L&D. So L&D is the portion of the unit where pregnant patients are actively laboring. You will have a number of labor rooms. It might just be 3 rooms or it might be 15 plus rooms. It really just depends on the size of the institution. And in those rooms, you will find pregnant patients that either came in laboring on their own or are having their labor induced for some reason. These rooms are where they deliver their babies and where they recover for a few hours, typically before being moved to the postpartum unit. So let's talk about that. The postpartum unit is pretty self-explanatory. This is where patients go after they deliver their babies. This is typically not where a patient would go after a miscarriage or a termination, but specifically where patients go to recover after delivering a 20-week or greater pregnancy. Patients generally will stay for about 24 hours after a vaginal delivery, 48 hours after a C-section, but again, that just depends on institutional protocol. Next, we have the antepartum unit. And this is where pregnant patients that are not in labor but need to be hospitalized for other medical indications stay. Some institutions will refer to this as the high-risk OB service or the MFM service, which is short for maternal fetal medicine service. Some antepartum units are as small as just having 1 or 2 rooms. Others are going to have 20 plus, again, depending on the size of the institution. Common reasons for pregnant patients to be hospitalized on the antepartum unit include preterm pre-labor rupture of membranes or PPROM, preeclampsia with severe features, uncontrolled diabetes, particularly if they're in DKA, pyelonephritis, multifetal gestations requiring regular fetal monitoring, and placenta accreta spectrum disorders. This is just to name a few. Most patients admitted to the antepartum unit are 20 weeks or greater in gestational age, but again, that depends on the institution and whether or not the hospital will admit pregnant patients less than 20 weeks to med-surg units. So the 4th unit is going to be OB triage, which is essentially the emergency room for pregnant patients. Most institutions will only manage patients that are 20 weeks and beyond in the OB triage unit, whereas patients who are less than 20 weeks would have to go through the adult emergency room. After the ED doctors make their evaluation of those patients that are less than 20 weeks, they will consult either the gynecology or obstetric services as needed. An exception to this would be if the hospital utilizes the OB triage unit as an OB emergency room and they bill as a separate emergency department, which is like where I work. And in that case, any pregnant patient, regardless of gestational age, would be sent to the OB emergency room. Common reasons for patients to come into triage would be for preterm contractions, labor checks, vaginal bleeding, not feeling their baby move, falls or injuries to the abdomen, or really any medical complaint that would normally be seen in the emergency department if they weren't a pregnant patient. Lastly, we have the labor and delivery operating rooms. Every L&D unit needs to have at least one operating room, but usually there are 2 to 3. This is where the C-sections take place, both scheduled and unscheduled. This is also often where dilation and curettage and dilation and evacuation procedures will occur, otherwise known as D&C and D&Es, or sometimes post-op takebacks. For example, if a postpartum patient came into OB triage after a C-section and her wound had opened up and needed to be washed out, then we could also do that there theoretically. But these ORs are only meant to be used by the OBGYN service, and surgeries performed by other specialties do not happen there. So there you have it. Now you know what to expect when you step onto the maternity unit for the first time. I hope you have fun.